AI is in the news and is increasingly part of people's day-to-day lives. But what does AI mean for healthcare quality? I'm Andy Reynolds. Today on Quality Matters, we find out the current state and the future direction of artificial intelligence in measuring and improving healthcare. I called a quality advocate who's an AI proponent. Aaron Neinstein, Chief Medical Officer at Notable. Welcome to Quality Matters. We're glad you're here.
Thanks so much, Andy. It's great to see you again.
Aaron, we should tell our audience that we're seeing each other again because we worked together at NCQA's Quality Talks in 2023, where you gave a memorable talk about the need for healthcare organizations to get below the surface of digital transformation. You argued that too many organizations have simply layered technology on top of existing systems. Now, you've gotten more involved with AI since then. How do you look back on those comments now in light of your work with AI?
Healthcare organizations have been working really hard to become more digital in many ways the past several years. When I gave that presentation, I felt high conviction. It was a really important step for organizations to take, but I didn't feel like the threat was imminent. I still see this as a challenge. And if anything, the threat is growing. With AI, the productivity shift that is possible is not single digit percentage points. We're talking order of magnitude differences. And so for organizations to implement technology and digital mindset is more urgent because the productivity you can get is so much higher. And conversely, if you don't, it becomes a competitive disadvantage.
Well, speaking of productivity, the healthcare economy faces labor shortages. That is, many people leaving the profession. Talk to me about productivity opportunities with AI, particularly in light of those workforce shortages.
Demographics is destiny. The workforce is getting older, and we're seeing increasing levels of burnout. People I talk to are saying 25% or more of primary care doctors will be leaving the workforce the next few years. If you look at administrative staff, there's 2 million unfilled job requisitions. So we're already facing staffing shortages. If you look on the need to deliver care side, the population's getting older. As people get older, they accumulate more chronic conditions. Their care needs are increasing. And so already it's challenging to get an appointment. If you're a care team, you're struggling to take care of a panel of patients and the burdens already feel overwhelming. We actually don't have the capacity to provide care for all of the people who need it. The demographics are going to make these problems worse. So one of the reasons that we're in a pivotal moment is just as these challenges are becoming overwhelming, we have this opportunity with AI to increase productivity in a profound way.
You wrote an article in Nature Medicine in 2022 titled, "Our AI Future is Better Than You Think." That title has always intrigued me because it implies that readers think the AI future is bad. Why did you think it was important to assure people that the AI future is better than they might expect?
That came out of my personal experience. I'm an endocrinologist, so oftentimes I think about this through the lens of diabetes. Historically, as an endocrinologist, you take care of people with type 1 diabetes, and the work was poring over dozens of pages of their glucose data, insulin data, looking for patterns. About 7, 8 years ago, along comes automated insulin delivery, which made minute by minute adjustments to people's insulin regimens. I did have this moment of, oh my God, maybe people with type 1 diabetes don't need me anymore. What I found was surprising and in many ways delightful. I've been spending the last 10 years trying to recount this to people who are going through those feelings now, which is the AI taking the work of having to be a computer and look through thousands of data points, looking for patterns. I'm not as good as a computer algorithm at doing that. Instead, I could talk to my patients and ask them how they were doing and what their fears were, their challenges were. And at one point, I met with a patient who, at the end of the visit, said, "It's been 25 minutes and we haven't talked about my blood sugars." And just had this realization that the ability to connect with my patients had been improved by having technology take some of this burden. One common task we have humans do is chart reviews en masse. Every team who thinks about quality has 5, 10, 20, 50, 100 staff who are doing chart audits, chart reviews, chart scrubbing, looking to see, has Andy had his eye exam? Has Andy had his A1C done? AI can do chart reviews en masse and quite successfully, never gets tired. And then on the back end, automation around the reporting. So we can keep NCQA happy and make sure we are sending the results. AI can help there as well. And so as I talk to people about AI entering healthcare, the first reaction people often have is fear that my job is going to be obsolete. I feel like I had this 10-year head start to see that actually a human supported by technology elevating what we're able to do in our ability to connect with people is actually better.
You've said elsewhere that AI can help restore the human connection in medicine. That seems counterintuitive. How does the computer help you be more human?
If you look at the cognitive energy a physician is spending when they're talking to a patient, a significant burden is using the computer, figuring out which menus, the right order, how am I going to find the right pharmacy in the list, typing information into the note while talking to the patient. There's a lot of distractions that are draining. If you think about what a physician's doing before and after seeing a patient, a lot is administrative friction and overhead. We really want people thinking about the patient's situation and synthesizing that all together, formulating a care plan, talking with the patient, freeing us up to do those things by relieving the cognitive burden of interacting with the computer and the friction filled tasks. Because when two people meet at a party and have a conversation, there's none of that other stuff, right? People talk, it's free flowing, you're just engaged and present. What's happened over the years is every worker is unable, physicians, front desk staff, medical assistants checking you in. People are not able to be present human to human because they're bogged down by all the tasks and systems they're trying to use.
You mentioned you had a 10-year head start on AI. How has your thinking evolved over those 10 years?
I had a realization the first day that I use ChatGPT. We can build solutions for problems in a matter of hours and days, not months and years. And the types of problems we can work on also is dramatically different. So not having to write down what you want to happen and go talk to your software engineering team and have them try to encode it in software. It's a long, arduous process. With large language models, you can interact in plain English. So the capabilities are more powerful. The number of problems that we can solve are much greater, and the speed with which we can develop is so much faster.
What have you been wrong about, or what has turned out differently than you thought?
Progress has been faster than I anticipated. Even though I was astonished by what I saw with ChatGPT 2 years ago that had a significant impact on me, I still felt we were years away from AI supporting higher level cognitive tasks, at conversing naturally with people, being able to inform diagnostic reasoning and things like that. But they're closer than I would have guessed a couple of years ago. I did a medical grand rounds at UCSF with Bob Wachter just after ChatGPT came out. Bob is department chair of medicine at UC San Francisco. Bob asked me, from 1 to 10, where are you on the scale of fear versus excitement about AI now? Somewhat cheeky, I said a 1 and a 10. The pace is moving very fast, and I was excited about what was possible. And at the same time, seeing a technology this powerful, you have to be concerned about the risks and potential harms. And this feeling of awe and respect and caution, the truth is I still feel that way.
That's quite a contradiction to reconcile. Where do you focus so that it all makes sense?
Nothing in healthcare AI makes sense except in light of seamless integration with clinical workflow. The mistake I've made so many times myself in my career that I've seen others make is, hey, we've got this great new tool. Come use it on the side of what you're doing today. It's going to be so good that it's going to be worth it for you to move out of your EHR or come use our tool, and it never works. People have their home that they do all of their work in every day, and the new tool, the AI, has to be tightly integrated into workflow, has to be integrated into the core system, or it's just not going to work.
Now, when you say workflow, are you just transferring things from a clipboard to a computer? Are you just transferring work, or are you reducing my workload here, Aaron?
We're aiming to reduce. If it's repetitive tasks that we can train a human to do, reaching out to a payer portal, submitting information, and getting a prior authorization result back, we can train an AI agent to do that task as well and actually remove the work from the human's plate.
You mentioned the risks and potential harms of AI, so let's get into those. Health equity is a quality priority, but many in the quality world are worried that AI will reinforce inequity. What do you think about that?
My friend and colleague, Dr. Atul Butte, coined the phrase democratized privilege. Just accessing healthcare today, in many ways, requires privilege. And what AI offers is, by increasing productivity, we might be able to actually help healthcare delivery organizations serve more patients. One part is actually improving access by improving productivity and efficiency in the healthcare workforce. The second thing is personalization. Today, everyone who calls, everyone who logs on to their patient portal, you get the same experience. No matter how old you are, no matter what part of the country you're from, no matter what language you speak. Well, it turns out people have very different educational needs. They have different levels of health literacy. And what if we could actually, when you interact with the healthcare system, what you get back is personalized to your level of health literacy, to your language, to your individual needs? That's increasingly possible with AI. And so those are the two places I'm really optimistic that we can really make a dent in, both relieving or lowering the barriers to access and then personalization.
An issue related to AI bias is the issue of transparency. That is, do the creators of AI systems understand how those systems work? And can you explain the AI system's decisions? What are your thoughts on transparency?
Yeah, I agree. One of the recommendations I make to organizations as they embark on AI efforts is to have guiding principles. Having principles as your guardrails is really important. Transparency should absolutely be on everyone's list. You have to know the outputs and to be able to compare them to what benchmark you would consider the gold standard. The other thing I recommend to organizations is to have a North Star. You need to know why you want to use AI and what are the core outcomes you're working towards. That's your North Star. That tells you what direction you're going in. And the guiding principles are sort of the guardrails. They're the bumpers on the side of the road that help you make sure you're pointed in the right direction and you don't drive off the road when you're headed towards that North Star.
To get another perspective on AI, I looked inside NCQA.
I'm Vic Wadwani. I'm NCQA's Chief Transformation Officer.
Vic, you're leading several pilot projects at NCQA that involve artificial intelligence, and you're involved with other transformations, including the enormous transition to digital quality measurement, a very common topic on this podcast. Now, Vic, people can only handle so many different transformations at once. So how should the quality community prioritize the digital transition and AI at the same time?
That's an excellent question, Andy, because it is A real one we get asked all the time, and it's a reality here at NCQA. I recommend folks not to think of them as two distinct efforts, not to think of AI experimentation as a separate thing, but think if I have a goal, advancing digital measurement, can AI play a role there?
Okay, so it sounds like you're suggesting people use AI to facilitate their transition to digital measurement. Is that right?
Yes. One example, we're seeing a lot of customers for our digital quality measures working to map their data to FHIR. AI can help do that. We have outputs of the EHR systems in continuity of care documents, CCDs. You could write a lot of algorithms to change data from structure A to structure B, but you could also use large language models to understand your continuity of care documents and convert them into FHIR resources. If you were to go to ChatGPT and say, take the CCD coming out from an electronic health record and convert it to a FHIR resource, it can do that.
Can you tell me more about how NCQA's use of AI could make an NCQA customer's life easier?
Take inter-rater reliability. We have human reviewers that look at evidence submitted by organizations that they're meeting certain standards. Machine learning algorithms can aid those human reviewers by saying, look, I found this evidence on page 67 of the attached. Or I looked at it, I didn't find evidence, but maybe you can. That's the internal use case. Now take that exact same capability and put it at the front of a customer submission of those evidence. A customer is submitting something, and that exact same algorithm is saying, I think you might be missing something because not sure that this meets the evidence requirements. You have now dramatically reduced the cycle of feedback and of a rater going back to a customer saying, I don't think I saw it in your documents. It's upfront. It's improving the customer experience. It's guiding them around what might not be there in their submissions in a way that can make quality evidence submission more real time. You don't have to wait for feedback in predetermined cycles. AI assisted technology can easily help customers on the front end.
Aaron, let's give you the last word. Are there things quality professionals might be tempted to do with AI that you think they should not do? In other words, what blind alleys or don't go theres might you dissuade people from pursuing?
One, be careful about putting private information into a public large language model. Do not do that. I recommend everyone try using AI for various use cases. Choose your partners wisely. They say the most important decision in life is who you choose to marry. AI is an important partnership you're entering, and you need to make sure that you share values, beliefs, guiding principles with your partners. Make sure you can look on the other side of the table and trust the partners that you're working with. So don't try to do AI alone, and develop your own guiding principles and make sure you share the values and direction you want to go with the partners you choose.
You mentioned the rapid pace of development in AI. If things are improving so much so fast, why shouldn't people just wait until AI gets really good before they start using it?
I think it's the opposite. The best way to learn is by doing. Start using AI now so you can understand what works, what doesn't, so you're prepared to discuss the pros and the cons, the risks and the benefits within your organization. It's not easy for organizations to snap their fingers and point AI at something and then it just works. So yeah, start using AI, even if it's just in your day-to-day work. Forget deploying it in your health system, just for your own personal purposes, so that you are not relying on articles you read or what you hear from people, but that you have a sense yourself of what's possible.
I think that's a good place to end. Aaron Neinstein, Chief Medical Officer of Notable. Thank you for joining us on Quality Matters. We really appreciate your time and your insight.
Thanks, Andy. Appreciate it. Thanks for great questions.
Thank you for listening to Quality Matters. You can always learn more at ncqa.org, and be sure to subscribe to Quality Matters wherever you get your podcasts. We'll see you next time.